My name is Alex Levin. I've been with Milwaukee Counselor for about a year and a half now. I received my Master's of Social Work from UW-Milwaukee with an emphasis in trauma-informed care. The emphasis in trauma-informed care is really, really important to me. I gained a greater understanding through education, but also through practical work that the experiences that we've been through, whether traumatic or not, have a huge influence on our thoughts and behaviors. This greater understanding into trauma-informed care then is utilized in the population that I work with. I've worked in different settings, individual and group therapy settings, which has really allowed me to meet and to build relationships with people from all walks of life. But also all various mental health diagnoses as well. These settings have allowed me to build a greater understanding for how I can work with a wide variety of people. I really enjoy working in individual settings because I think that we're able to establish a closer connection. This bond that we're going to establish together is going to allow us to dig into some areas of your life that have been really difficult for you to maybe talk about with other people. And I want to build that trust and that rapport with you so that you're able to trust me and able to talk about some things that you may not even be able to talk to your family about. I specialize in working with adults with varying mood disorders, such as anxiety, depression, bipolar, also people who have been through or are going through life transitional periods. This could be losing a job, starting a new career, in the middle of a relationship, or just out of a breakup. I've also experienced working with couples and families. When I work with couples and families, it gives me a lot of sense of satisfaction that we're able to help build stronger relationships. I utilize a couple of different therapy styles. I use cognitive behavioral therapy, dialectical behavioral therapy. I focus very heavily on mindfulness, whether that's guided meditations, just being more present in the moment and not judging your thoughts and behaviors. This can be really difficult for people, especially in the world that we're in, where we focus a lot on what do I have to do next. But I want to challenge you to focus on where are we at in the present moment so that we can really appreciate ourselves, but then the relationships and the growth that we can see in ourselves. Throughout these different modalities, I want to make sure that I can meet your needs and that we can have your learning style be adapted, individualized into how we can set up our treatment plan. The treatment plan is established through the first couple sessions that we have. We'll set up the treatment plan, look at the areas of growth that you want to see in your life, and I also really want to challenge some of those thoughts, behavior patterns, and maybe some underlying themes that we can find so that we can take those and then help you learn how to adjust and manage those situations out in the environment that causes all of this stress. By prioritizing your mental health and making sure that your needs are put first, you're able to integrate all aspects of your life, your physical health, your emotional health, your spiritual health. And by not neglecting or dismissing any parts of your life, you're able to gain a greater understanding of who I am as a person and how I can influence my mental health to give me those life satisfaction goals that I've always been looking for. So if you want to work with me, I'm more than happy to take phone consultations, and I want to make sure that this is the best fit for you. You're prioritizing yourself, you're putting yourself forth first, and I think in mental health, that is the thing that I think falls to the wayside sometimes. We prioritize our family, we prioritize our kids, our job, but this is your opportunity to prioritize yourself. Milwaukee Counselor has given me the opportunity to gain a greater understanding of what a therapy setting should be like. When you come into our room, it's comforting, it's safe, it's warm, it gives you the sense that you may be at home sitting on your couch. I think for me, the most important part of a clinical setting is being able to feel comfort, being able to feel like I can just take a deep breath and not have to worry about judgment. Once you walk in that door, there is no judgment. Working for Milwaukee Counselor, from the time that you talk to Brianna as our care coordinator to the time that we first meet, we want to make sure that this process is as easy as possible for you. One thing about Milwaukee Counselor that is different than a lot of other places is having a secure portal where you can put all of your information and trust that it's going to be confidential and it's compliant with HIPAA. Making sure that this process of signing consent forms and all that paperwork that we tend to not like is as easy as possible. We have a secure portal to help with payments, to check with billing, to work with your insurance if that's something that's within your needs as well. We want to make sure that this process is as simple as possible, and all you have to do is walk in the door and sit down on the couch. By choosing Milwaukee Counselor, you're choosing a simple way, but also an effective way to treat your mental health.